Hi, welcome back to Inside Guelph. Well, I know, you head to the gym, you think you're doing all the right exercises to stay healthy and happy, and then, oh, your back hurts. Well, it turns out some of those exercises may not be so helpful. Mark Kubert joined us, chiropractor, to walk us through it. Thanks for being here.
Thanks very much for having us.
So some of these exercises, not so good.
Well, they're not, Trish. Back pain, as we know, is common. Most of us experience it at some point in our lives, and often after we've had an episode, a lot of us are motivated to do exercises to help it to get better. The problem is that many of those traditional core exercises, the one that work our midsection, can actually be promoting the problems that they're trying to prevent.
Okay.
And so the big 5 exercises that we encourage our patients to avoid are sit-ups and crunches, so any of those type of flexing motions.
Avoid.
Avoid.
Best news I've had all day. Stop doing sit-ups. Yep.
Doing back extensions, so leaning back far.
Okay.
Doing any sort of trunk twists, and doing some leg lifts.
So that literally you just did my entire workout.
I know.
All bad.
And often when I tell patients this, they say, "Well, what else is left?" And we'll certainly get to that in the end there.
Right.
But there's studies that show that any of those exercises or combinations of them actually put tremendous amounts of stress and strain on your low back, much more than what we should be exposed to on a daily basis. And that's why we recommend that people avoid them.
Okay, and you brought your spine in.
I brought the spine here.
All good chiropractors carry around with them.
Exactly, right from my back pocket here. Now, if we look at the spine from the side, we can see that it's not actually straight. It's made up of alternating curves. And when you're sitting with proper posture, that nice and upright, or standing with proper posture, just like you and I are doing, we can see that the spine has all the forces around it balanced the best. And so this is the best position and safest position for your spine to be in, whether you're just doing daily activities, but especially when you're doing exercises. And if we focus more closely on this lower portion of the spine, your lumbar lordosis, we see that there are vertebrae, and in between each vertebrae is a shock absorber called the disc. Now the disc is much like a jelly donut. You've got a tough outer casing and there's jelly on the inside. Now when you're doing an exercise such as a sit-up or a crunch, you flex your spine forward and you can see that that actually pushes the vertebrae down on the front of the disc. And that means that the jelly inside wants to get pushed out and squeezed to the back, and that puts tremendous stress on the disc. And it can actually start to develop little micro tears. Now, if you do this just once, it's not that big a deal.
Right.
But it's that repetitive nature of these exercises that can turn just a little micro tear into a bigger symptomatic
So you're saying, here
injury.
we go, we've injured our back, and then we go thinking we're doing the right thing by doing sit-ups, and the extensions, I'm assuming, is just the opposite of what you explained. Uh-oh. So what can we do? Are there some safe ones?
Well, there's certainly no denying that these exercises work those muscles, but they do so at the cost of the other things. So other exercises, there are things that we can do that are much healthier and much safer and still effective.
Okay.
The big thing to remember is keeping your back in that neutral, balanced position. So exercises, some people are familiar with the plank, or a version of that is the side bridge, or sometimes lying down on your back and lifting your hips off the ground, called the glute bridge.
And this is all working our core, but we're keeping our spine in this position.
Exactly.
So if you're always thinking of keeping in that position, we're safe?
That's exactly it. Keeping your back in that balanced, neutral position, but still challenging those muscles to hold you in that position, is a wonderful way of keeping your back in good shape, but not causing any of those potential injuries.
Okay, so obviously if people have questions, you're recommending finding a qualified chiropractor to walk them through what exercises they're doing and what's safe and not safe for their particular case.
Definitely, definitely.
Okay,
because every case is different.
Of course, right. Well, thank you, and thank you for bringing in your friend, the spine.